A study from the Mayo Clinic revealed that 70% of Americans under the age of 64 take prescription medications. And as you might suspect, this number doesn't get better with age. In fact, the Center for Disease Control and Prevention reports that 89% of adults 65 and older are taking prescription medications, with a large majority taking more than 5 prescriptions. This is a problem of epidemic proportion, but it's made worse because many of these medications can either cause peripheral neuropathy or worsen the nerve damage you already have. Today, I'll reveal 4 commonly prescribed medications that are linked with causing peripheral nerve damage and worsening the damage of your nerves. Don't go anywhere, it's gonna be good. The field of medicine is continuously moving forward. Our life expectancy is longer than ever, despite the fact that the overall quality of our health continues to diminish. And this is because the trend in America is a pill for every ill. As a nation, we tend to chase symptoms, create a pill for them, and then give it a fancy diagnosis. We think all medications are innocuous and tend to forget that each medication comes with a long laundry list of side effects which will create their own set of symptoms and a new health problem. This turns into a downward spiral of having to add in another medication, then another, and another to treat the vast number of negative side effects. When we look at our older adults, I already mentioned that 65-year-olds and up are typically on at least 5 medications. But the statistics paint a further dire picture. Most adults 70 years and up are on anywhere from 9 to 13 different prescriptions. It's important to realize that with this, there are a rise in number of medications that can cause or worsen peripheral neuropathy. So in this video, I'll cover the top 4 medications that have been shown in research studies to cause peripheral nerve damage. Before we get started, I'm going to post an important disclaimer. Never stop taking any medication without consulting your doctor first. This could be very harmful to your health. Now, let's start with number 4 on the list, anti-anxiety medications. The National Institutes of Mental Health states that more than 20% of Americans ages 12 to 80 are taking some form of anti-anxiety drug. These drugs aren't just used to treat anxiety. Many times they're prescribed to adults as sleep aids. And again, the long-term ramifications are peripheral nerve damage. Here's a list of medications in this group. Leave me a comment and let me know if you've been prescribed any of these drugs. Top on the list, Ambien, Buspar, Diazepam, Klonopin, Xanax, and Lorazepam. Number 3 on the list is antidepressant drugs. Since the 1980s, the use of antidepressant medication has risen by more than 400%. And the National Institute for Mental Health states that 1 in 4 people now take some form of antidepressant such as Prozac, Celexa, Cipralex, Lustrol, Mirtazapine, Effexor, amitriptyline, nortriptyline, and Cymbalta. Now, I'm going to share an extremely important side note with you regarding Cymbalta and its generic duloxetine. This drug was only approved for the use of depression. However, just recently it was approved to treat peripheral neuropathy, even though it's widely known to worsen peripheral neuropathy damage. Now, here's an important fact to take note of. Cymbalta has a potent physiological addiction, and when you're trying to stop taking Cymbalta, many people will experience withdrawal symptoms called brain zaps. This is a very strong electrical shock sensation in the brain, which is extremely painful. My patients have told me it feels like their brain is being electrocuted over and over again. As a result, most doctors simply place their patients on Cymbalta and never take them off because trying to wean them off is slow, difficult, and a painful process. Dr. Montero had 1 young girl, 17 years old, who was placed on Cymbalta for her fibromyalgia. By the way, this drug was never approved for treatment of fibromyalgia. This patient noticed that the medication wasn't helping at all, but her doctor refused to take her off it. So like most well-educated teens, she decided to stop taking it. Then came the horrific brain zap. Well, Dr. Montero did a tremendous amount of research and found out that in order to prevent these severe withdrawal symptoms, the patient must be slowly, and I'm talking very slowly, weaned off at the rate of decrease in doses by only 10% every few weeks. So the message that I'm trying to share with you is try your very best to avoid this drug whenever possible. Now, number 2 on the list is a class of blood pressure medication known as calcium channel blockers. There are many blood pressure medications that can result in peripheral nerve damage as a side effect. However, this one class of antihypertensive is by far the worst. Amlodipine, diltiazem, felodipine, isradipine, nicardipine, nifedipine, nisoldipine, and verapamil. If you're currently taking any of these drugs, you need to speak with your doctor immediately and request that he or she switch you to a different class of blood pressure medication. Other classes include ACE inhibitors, beta blockers, and angiotensin receptor blockers. Your doctor will be able to determine which of these would be best suited for your condition. If your doctor refuses to switch you, well, it may be time for a new doctor. And moving on to number 1 on the list, and that is statin medications. Statins are a group of medications used to lower cholesterol. More than 200 million people worldwide take statin medication despite all the harmful side effects it poses. In fact, in 2012, the FDA mandated a black box warning for all statin drugs due to their significant side effects. Statins go by the name of atorvastatin, fluvastatin, lovastatin, pitavastatin, pravastatin, rosuvastatin, and simvastatin. They've been found to cause diabetes, memory loss, and amnesia. They also cause peripheral neuropathy by causing significant damage to the myelin sheath of the nerve. Statins also deplete coenzyme Q10, which is vital for mitochondrial function of the nerve cells and all other cells in the body. And lastly, statins have been linked with increasing your risk of developing cancers such as colorectal cancer and pancreatic and prostate cancer. Remember, the best way to lower your cholesterol is with lifestyle changes. Follow a ketogenic diet, implement intermittent fasting, and exercise. However, if you temporarily need a cholesterol-lowering medication, there are other alternatives to statins such as PCSK9 inhibitors, known as Repatha and fibrates. Now, don't forget, there are many natural alternatives that you can use to effectively lower your cholesterol. It's important that you align yourself with a functional medicine doctor or a naturopath that can help you.
I'm going to go over 6 additional drugs that commonly cause peripheral nerve damage as a side effect. Make sure you watch this video until the end because I'm also going to share with you brand new information about Gabapentin and Lyrica or Pregabalin that will leave your jaw hanging open. The research findings on these 2 drugs were just released 3 months ago, so I'm certain your doctor isn't even aware of them. Now, let's start with number 6 on our list, anticonvulsants or anti-seizure medications. For years, physicians refuted the possibility that anticonvulsants cause peripheral nerve damage. However, there's been substantial evidence that proves the contrary. In 2019, the International Journal of Neurology and Neurotherapy published a study that revealed that the link between several commonly prescribed anti-seizure medications and peripheral nerve damage were imminent. Let's take a look at this list. Phenytoin, phenobarbital, topiramate, carbamazepine, sodium valproate, Keppra, lacosamide, and gabapentin. Wait a minute, gabapentin? Isn't this used to treat peripheral neuropathy pain? Yes, it is. So the same drug that's being used to control your neuropathy symptoms can actually worsen the nerve damage with prolonged use. Here's a side note, guys. Make sure you watch this video until the end to hear about the groundbreaking news about gabapentin, Neurontin, Pregabalin, and Lyrica. Okay, now on to number 5, HIV medications. Peripheral neuropathy is one of the most frequent neurological complications of HIV drugs, resulting in a significant increase worldwide of HIV neuropathy. Nerves that can commonly be affected are sensory and motor peripheral nerves, thoracic nerves, cranial nerves, or autonomic nerves. HIV drugs linked with peripheral nerve damage are didanosine, emtricitabine, stavudine, Truvada, Atripla, and zalcitabine. Next, let's take a look at number 4, immunosuppressant medications. Immunosuppressant medications are used to treat many autoimmune disorders like rheumatoid arthritis, lupus, psoriasis, or psoriatic arthritis, Crohn's disease, ulcerative colitis, multiple sclerosis, and alopecia areata. However, there are a few drugs within this classification that can cause damage to both the structure and the function of the peripheral nerves. Those medications are Enbrel, used for rheumatoid arthritis and psoriatic arthritis; Remicade, used for inflammatory bowel diseases like Crohn's and ulcerative colitis; Humira, used for inflammatory bowel disease; Arava, used for rheumatoid arthritis; and Xeljanz, used to treat rheumatoid arthritis, psoriatic arthritis, active ankylosing spondylitis, and moderate to severe ulcerative colitis. Now, let's move on to number 3, cardiovascular or heart medications. There are several different classifications of heart medications that have been linked with causing peripheral neuropathy. In our last video, Dr. Coppola reviewed the damaging effects of calcium channel blockers for high blood pressure. Today, we're going to go over medications used to treat heart arrhythmias or abnormal heart rates, edema, which is swelling or water retention, and another antihypertensive for lowering your blood pressure. Let's start with amiodarone. This drug is used to treat heart arrhythmias and has been linked with causing peripheral neuropathy. Research has found the higher the dose and the longer you're on this drug will raise your risk for developing nerve damage. Next, let's talk about hydralazine. This medication is used to treat high blood pressure, and it falls into the classification called vasodilators, meaning it widens the blood vessels. This medication can begin to damage peripheral nerves within 3 weeks of taking it, but it can also take up to 2 years before the damage is significant enough to become symptomatic. Last in this category is a class of drugs called diuretics or water pills, which are used to treat hypertension or high blood pressure. But it's also prescribed to eliminate extra fluids from your body, like swelling in the ankles or the legs. The problem with this class of medication is, as it's eliminating the excess fluid from your body, you lose a tremendous amount of minerals that your nerves rely upon for proper nerve communication. The most common minerals lost due to a diuretic are calcium, magnesium, potassium, and zinc, which ultimately can result in nerve damage. Commonly prescribed diuretics are thiazide diuretics, such as hydrochlorothiazide or HCTZ, microzide, chlorthalidone, and Lasix, also known as furosemide. Also, aldactone. If you're taking any form of diuretic, it's important to take a mineral supplement to replenish what's being lost. I'll leave a link for you below for a few of the important minerals that you should be on. Now, let's talk about our next group, number 2, chemotherapy drugs. With the dramatic rise in cancer rates from all age groups, we see more and more cases of chemotherapy-induced peripheral neuropathy, also known as CIPN. It's well known that chemotherapy drugs do extensive damage to peripheral nerves, and certain classes are more destructive than other classes. For instance, 90% of people who receive platinum-based chemotherapy will develop peripheral neuropathy, and these drugs include cisplatin, carboplatin, and oxaliplatin, which are widely used in the treatment of lung, breast, ovarian, and colon cancers. Another class of chemotherapeutic drugs called taxanes will cause 57 to 83% of patients to develop moderate to severe peripheral neuropathy. Taxane drugs include docetaxel, Araxol, paclitaxel, or a combo of paclitaxel and Asequidere, and also Taxotere. Taxanes are commonly used for metastatic breast cancer, ovarian and lung cancer, as well as Kaposi sarcoma, a cancer of the lymph or blood vessels. This next class of chemotherapy, called vinca alkaloids, has a much lower incidence of peripheral neuropathy. Only 30% of people receiving this treatment develop neuropathy, and drugs in this group include vincristine, vinblastine, and vinarobene. Vinca alkaloids are used to treat lymphomas, acute lymphocytic leukemias, and solid tumors. Now, here's another extremely important side note, guys, which is critical. Dealing with cancer is scary enough, let alone being stuck with peripheral neuropathy as a side effect. There is a way that you can avoid developing peripheral neuropathy while undergoing chemotherapy, and it won't interfere with the effectiveness of the chemotherapy drug. In fact, typically, it helps indirectly because oftentimes the oncologist has to stop or slow down the chemo when the neuropathy symptoms become severe. So, what am I referring to? It's an amino acid called acetyl-L-Carnitine, or ALCAR for short. Clinical studies have proven that taking 2,000 to 3,000 milligrams of acetyl-L-Carnitine while undergoing chemotherapy can prevent peripheral neuropathy, or at least minimize it to a very mild case. And studies found that it doesn't impair the action of the chemotherapy in any way. So this is huge. Well, that takes me to our last category. Number 1. Oral diabetic drugs. Science has shown that more than 2/3 of people with diabetes will develop nerve damage due to chronically elevated glucose levels. And statistics show us that 70% of all diabetics use oral medications. But did you know the most common prescribed oral diabetic drug has been linked with causing peripheral nerve damage? On top of that, it can also worsen existing nerve damage and neuropathy symptoms. This culprit is metformin, which is also sold under the brand name of Glucophage CR. Research has shown that metformin will cause low levels of cobalamin, vitamin B12, and elevated levels of homocysteine. Now, your nerves are vitally dependent on adequate levels of B12 to maintain the myelin sheath and the integrity of the nerve function. Elevated levels of homocysteine raise inflammation in the body, increasing nerve damage and irritation, and it causes damage to the walls of the arteries. This leads to decreased blood flow, oxygenation, and decreased vital nutrients that are delivered to your nerves. Whether or not you have peripheral neuropathy, anyone taking metformin should also take methylcobalamin to counter the deficiency that it will cause, which will lead you into peripheral neuropathy. You should also take vitamin B6 in the form of pyridoxal 5-phosphate and folate in the form of 5-MTHF or quadrafolic to prevent elevated homocysteine levels. If you'd like to learn more about what you can do to prevent diabetic peripheral neuropathy, make sure you watch the second part of our video series on reversing diabetic neuropathy. I'll leave a link for you down below in the description box. Now, we're not quite done yet. Here's the bonus information I promised you. In preparing this talk for all of you, Dr. Coppola and I always go back and we recheck all of our research to make sure we're still current with what we're reporting to you. Well, I was shocked, and I do mean shocked, to come across this brand new research that was just published back in September of 2022 in the peer-reviewed journal Cardiovascular Diabetology. Here's what was revealed. Researchers reviewed over 210,000 cases of patients with diabetic neuropathy. And what they found was that when these patients were treated with either Gabapentin, Pregabalin, or the brand name counterparts, Lyrica, within 5 years, there was a substantial increase of patients who experienced myocardial infarcts, also known as heart attacks, strokes, heart failure, peripheral vascular disease, deep venous thrombosis, and pulmonary embolism. This study revealed that these episodes could appear in as little as 3 months after beginning these drugs. So what this means is the 2 most commonly prescribed drugs used to treat peripheral neuropathy pain and symptoms can either kill or debilitate you. I don't know about you guys, but when I saw this, I just about fell off of my chair. I guarantee if you ask your doctor about this, they won't have the foggiest idea, and they'll tell you this can't possibly be correct. Now, in their defense, this research study was only just released a couple of months ago, but I assure you it's valid. Well, by now, you might be shaking your head going, well, what the heck do I do? I have to take metformin or any of the other medications you might be on that I mentioned that are on this list or the other video series we did. So the very first thing you need to know to protect your nerves and to defend your nerves is you need to start by taking Acetyl-L-Carnitine. This is going to be the best form of nerve defense that you can have. This amino acid doesn't just offer nerve protection against the damaging effects of chemotherapy, it protects the nerves from all toxic chemicals as well as elevated levels of glucose. Well, that's it for now, gang. When you turn off this video, I don't want you to feel frightened. I don't want you to feel frustrated because you're on 1 or 2 or maybe even 5 of the medications that we have listed in both of these videos. I want you to feel empowered by the knowledge that you don't have to become a victim to their side effects. So, the first thing you can do is start by taking Acetyl-L-Carnitine to defend your nerves. It's going to be your best first line of defense. Next, find a functional medicine doctor in your area that can help you reverse some of these chronic illnesses that you're battling. Many chronic illnesses are completely reversible, but that's not going to happen if you're only working with a medical doctor because medical doctors are trained to treat the symptom by prescribing drugs. This doesn't make them bad doctors. It's simply the approach that the traditional medical model uses. I'm going to include a link below to help you locate a functional medicine doctor in your area. All right, gang. Well, thanks for watching, and please be sure to like this video and share it with others. This really helps neuropathy sufferers know there is hope and they're not alone. Until next time, my friends, I look forward to seeing you on the road to great nerve health. Blessings. And look at him. Hi. Yeah, show everyone those beautiful eyes. Hi, honey. You came to visit us? This is the first time. How are you, my baby? You want to show everyone those beautiful eyes of yours? Yeah, you want to show everyone your pretty eyes? Hi.